Hi, my name is Kweko. I'm a pharmacist. In this video, I'll be reviewing the medication Metoprolol. We will take a look at its uses, how it works, dosing, how to take it for best results, precautions, and some side effects. Before I start, I just wanted to mention that this review is for informational purposes only, so please do not stop, or make any changes to your medications without first talking to your doctor. So what is Metoprolol? Well, Metoprolol is a medication that belongs to a group of medications that we call beta blockers. They are very easy to identify because they typically end in the letters OL. So we have carvedilol, atenolol, bisoprolol, and so forth. Now, Metoprolol is approved to treat a number of conditions that affect the heart and the blood vessels, such as angina, which is a severe pain in the chest caused by inadequate supply of oxygen or blood to the heart. Then we have congestive heart failure, which is a situation where your heart can pump blood well enough to meet your body's needs. And then we have the one that we all know, hypertension, or what we typically call high blood pressure. Now, there are some off-label uses. Now, when we say off-label use, it means that the medication is not necessarily approved for that condition, but it is used anyways due to past experiences or knowledge that it works for those conditions. So a typical example is that after an acute heart attack, the heart is more vulnerable to stress and increased workload. So metoprolol may be given to help protect the heart during this recovery period by reducing the heart rate and the workload on the heart, and potentially preventing another heart attack from happening. Metoprolol may also be used off-label for atrial fibrillation, which in very simple terms means irregular heart rhythm. So how does metoprolol work? Well, metoprolol works by blocking the action of adrenaline, also known as epinephrine, on what we call beta receptors in your heart and blood vessels. Now, when adrenaline binds to these beta receptors, it causes your heart to beat faster and harder, and your blood vessels tend to constrict. Now, these actions of adrenaline ordinarily prepare you for what we call the fight or flight response, where your body is preparing to escape or to fight some danger. Now, unfortunately, this response increases blood pressure and your heart's oxygen demand. So by blocking beta receptors, metoprolol prevents adrenaline from having these effects. So ultimately, what this results in is that there is a slower, more regular heartbeat, there's a lower blood pressure, there's reduced oxygen demand of the heart. So how to take metoprolol? Well, for starters, you should always follow your doctor's directions on how to take your metoprolol. There are two forms of metoprolol available: metoprolol tartrate and metoprolol succinate. Now, metoprolol tartrate is a short-acting form, which is usually taken twice a day. Metoprolol succinate is, on the other hand, is the long-acting or extended release form that is typically taken once a day. Now, to help you remember to take your metoprolol, best practice is to take it around the same time or times every day. Now, let's talk about dosing. The dose of metoprolol that you need will depend on your condition, your age, your weight, and other factors. Obviously, your doctor will determine the best dose for you based on your medical history and your response to the medication. However, here are some general dosing guidelines for adults, and I'm saying general because it may not be specific to you. So for high blood pressure, the usual starting dose is about 25 milligrams to 100 milligrams of the metoprolol tartrate, usually taken twice a day, or the 25 to 100 milligrams of the succinate given once a day. The maximum dose is 400 milligrams per day, but to be honest with you, in practice, I hardly see anybody taking 400 milligrams of metoprolol. For angina, the usual dose is about 50 to 100 milligrams of metoprolol tartrate 3 or 4 times a day, or 100 to 400 milligrams of metoprolol succinate once a day. Here again, the maximum dose is 400 milligrams. For heart failure, you will see doses starting about 12.5 to 25 milligrams of the metoprolol succinate once a day. The dose may be increased gradually every 2 weeks until the maximum tolerated dose is reached. The maximum dose typically that you're going to see in everyday life is about 200 milligrams per day. Now let's talk about some precautions or some things you should know about if you're taking metoprolol. The first one is if you're diabetic or diabetes. Metoprolol may increase your blood sugar levels and mask the symptoms of hypoglycemia. That's when your blood sugar goes too low, such as tremors, sweating, or palpitations. If you have diabetes, you may need to monitor your blood sugar closely and make sure all your numbers are where they're supposed to be. You should also be aware of the other signs of hypoglycemia, such as hunger, headache, confusion, and weakness, so you can make an informed decision if you experience any of these. Second precaution is surgery. Metoprolol may interfere with some anesthesia drugs and increase the risk of complications during or after surgery. So if you are scheduled for a surgical procedure, make sure to tell your doctor you are taking metoprolol. Your doctor may advise you to stop taking the metoprolol maybe a few days before the procedure, or switch you to a different medication. Also, if you have asthma or COPD, metoprolol may worsen your breathing problems by causing bronchospasm, which is the narrowing of the airways, and increasing sensitivity to allergens. If you have asthma or COPD, be sure to inform your doctor beforehand. This is relatively rare though, because metoprolol tends to be more selective for the heart and is less likely to affect the lungs, like some of the what we call cardioselective beta blockers like labetalol and pindolol. Another precaution is to avoid abrupt discontinuation. You should not stop taking metoprolol suddenly without consulting your doctor. Doing so may cause your condition to worsen or trigger withdrawal symptoms such as chest pain, irregular heartbeat, or dangerously elevated blood pressure. Your doctor will typically advise you on how to taper off metoprolol gradually if needed. Now let's talk about side effects. Now, metoprolol may cause some side effects, especially when you first start taking it or when your doses change. Most side effects, I might say though, are mild and temporary and go away as your body adjusts to the drug. However, some of them may be serious and require medical attention. Some of the most common side effects include drowsiness, dizziness, or lightheadedness, which may be a sign that your blood pressure has probably dipped too low. So it's always good to know how your body reacts to the medication before you engage in any activity that requires alertness. People have complained of headache, and there's been complaints of fatigue or weakness. In some instances, nausea, vomiting, diarrhea, or constipation have all been reported. Abdominal pain or bloating, dry mouth, trouble sleeping or nightmares, depression or anxiety, decreased sex drive or performance, and one that is not usually reported, weight gain. Now, if weight gain occurs, you may want to talk to your doctor about some of the relatively newer beta blockers like carvedilol, which tends to be relatively weight neutral. So if you're having issues with gaining weight on metoprolol, there's definitely help out there, so don't suffer in silence. Now, the next set of side effects are rare but potentially serious if they do happen, and these are the ones that I would recommend that the moment they happen, you need to alert your doctor. These include a slow or irregular heartbeat, shortness of breath or trouble breathing, swelling of the hands, feet, ankles, or lower extremities. If there's weight gain, I know I mentioned weight gain, but if this weight gain is sudden, it may be a sign of worsening heart failure, and therefore you need to report it immediately. Obviously, fainting or severe dizziness, coldness, numbness, or tingling or pain in the hands or feet are signs that something is not right, and you should generally reach out to your doctor immediately. So, high-level overview of metoprolol. I truly hope you found some value in it. If you did, please give it a thumbs up and make sure you're subscribed to this channel. Thank you so much. Stay blessed. Catch you on the next video.